The next question is from Ankit Kumar from India Today. But before Ankit comes on, I'd like to remind everybody to use the raise your hand icon and to apologize for saying #9. It's *9 on your keypad for your telephone. Ankit, are you there? Can you go ahead with your question?
Thank you, Margaret. Good evening, everyone. My name is Ankit Kumar. I represent India Today and Ask Tag. In India, there is 3 weeks long lockdown, which means 1.3 billion people are currently inside their homes right now. But we keep hearing about a possible second and a third possible wave of outbreak in near future. A country like India cannot afford many such lockdowns after this one ends. What is WHO's best advice to Indian policymakers, what they must do during this lockdown to ensure that there isn't an outbreak and such a lockdown again in near future? Also, if you could please tell us how far are we from a possible vaccine or a medicine? Thank you very much.
Thank you, Mr. Kumar. Your question is a very good one, and I think the Director General answered that question very much in his address. He mentioned the 6 things that every country needs to do to use this window of opportunity. And as I've said in previous press conferences, India has incredible capacities to leverage, accelerate, and expand its capacity. But it must do the things. You must have a system to find cases. You must test. You must expand your capacity to treat and isolate. You must be able to quarantine your contacts, and you must bring an all-of-government approach to the response. If those things are put in place, and I know they are being put in place, but if we can accelerate that, and India is a vast country, you could never look at India just as one single entity from an epidemiologic perspective. And if you remember, those of you who in India who were involved in the process, India got rid of polio by breaking it right down. India got rid of polio by breaking it down to the village level, all the way through the system. It broke down the problem. It went after the polio virus district by district by district by district, and India won. If India does the same thing, breaks down the problem, puts in place the measures that are needed, both surveillance and healthcare measures, and does that systematically, then there is a way out. There is a transition from lockdowns into a public health driven response in which people don't have to stay locked in their homes for more time than is absolutely necessary. Without implementing the necessary measures and without putting in place those protections, it's going to be very difficult for countries to exit. And when they do, they may have resurgence. And I think that's the challenge now. We have time, very little, as the Director General said, a second but small window of opportunity. What countries do today, tomorrow, the next day is what's going to matter.
If I could add to that, so we have seen countries that have gone through these so-called lockdowns, have gone through these public health measures and distancing measures, and we need to learn from all of these countries who have applied these measures at different levels of intensity. We know what measures were taken in China, and in particular in Wuhan and in Hubei, and we know that these measures are being lifted now. And the reason that they can be lifted is because these systems are in place to actually quickly identify and isolate any cases that pop up. And now what we're seeing in China is we're not seeing cases, indigenous cases that are being locally transmitted. We're seeing new importations. There are more importations that are going into China than are actually being detected from local transmission. We haven't had local transmission, I think, in a number of days now. But what my point is bringing up China is saying they have looked at a staggering approach of lifting these measures. It wasn't all at once across the whole country. And in different parts of the country, they applied different intensities or levels of these measures. So it wasn't a total lockdown in all places across China. We know in Singapore, they used a different approach. They did have some application of social distancing or physical distancing measures, but they didn't close their schools. And so it's really important for us to take the examples of all of these countries and look in detail about what they did as it relates to the epidemiology in their country and learn from them. And we are doing that now. We are taking very detailed looks at what every country is doing, what countries have done, and the levels of success that they have had. So again, we can come back and say, these are the things that really have worked. We know the things that we're telling you, these are the things that work. We know that they're incredibly difficult, but what we don't want is to get into a situation where you have a lockdown, then you lift it, then you have a resurgence, and then you have a lockdown, and you have this endless cycle. We need to break that cycle so that these measures that are put in place are temporary, and we know that these are incredibly difficult, and we thank you for playing your individual part in this outbreak. But we know that these things work. They are temporary. We will get through this, but those measures to find those cases, isolate those cases, find and quarantine your contacts, treating patients who require treatment is really, really critical.
And I think for India, with 606 cases, I have already outlined the 6 steps. Doing that now will help India to stop from the virus spreading to more places or, getting bigger. And as Mike said, India has the capacity, and it's very important and good to see that India is taking early measures, and this will help you to suppress and control it as soon as possible before it gets serious. So it's very important, like what's happening now in India, which we really commend, to cut it from the bud when you only have 606 cases only.